If you've never seen an OB/GYN before, I think you're going to be surprised at the providers and their personalities. I think that we're a fun group of people, and I think that you'll be surprised at how quickly I hope that we will establish a connection with one another. That we make conversation. We want to get to know you. We want to get to know your concerns and really develop that relationship. An OB/GYN and women's health perspective for practicing primary care, I think we offer a lot. Not only the relationship aspect of growing with a patient and truly becoming familiar with their medical history, but also I think OB/GYNs are good detectives, and we have to be good detectives for treating obstetrical patients, treating gynecologic patients, that we work with them to find out, to work through their problems and figure out how we can best treat them. I think that OB/GYNs are really uniquely apt for that particular job because, again, we develop these relationships with these patients over a long period of time. Shared decision-making, I think, is paramount for how I practice. When I meet with somebody, we try to figure out a priority for their visit, their game plan for their visit, as well as what, setting our expectations on what we may be able to attain together. I think patient autonomy is incredibly important in healthcare, and really trying to emphasize shared decision-making on how somebody will develop their own healthcare. And I'm a big believer in patients owning their healthcare, that it's important to me that when somebody comes in with whatever medicine they might have or problem that they might have, that they really understand why they're taking it and why their treatment plan is as such, so that they have a full view of what's going on in their life. I think all patients, before they come in for their OB appointment, should come with questions. And I think it's great that people come with questions, and they will do reading beforehand, and they'll come with ideas, because I like our appointments to be a conversation. I think at OB/GYN, we have to be a very accommodating type of physician, and we need to work together to help somebody through their prenatal journey, working towards that happy delivery, obviously. But I like that when people come in with questions and they have ideas and they want to talk about things, and sometimes we need to pivot, we need to navigate things. But I also think that's what I'm here for. That's what your OB is here for, is that we're resources to help figure this out.